Hello, everyone. Welcome to our virtual tabling, where today we are going to continue on with our heart health theme, and we're going to talk about knowing your risks, specifically your risk factors for heart disease. So without any further interruption, let's get started. So what exactly is heart disease? So heart disease refers to several types of conditions that can affect the heart. The most common one is, in the US at least, is coronary artery disease, and this affects the blood flow to the heart. So your heart isn't getting as much blood as it should be. So what are the symptoms of heart disease? Well, it can be kind of tricky. Sometimes, but not always, you may not even be diagnosed until you have a cardiac episode. And this can actually refer to things such as like a heart attack, arrhythmia, which is like an abnormal heartbeat, or even heart failure. It's important to note that heart failure doesn't necessarily mean that your heart has failed and is not pumping blood. It just means that it's not pumping blood as adequately as it should be. Symptoms of each of these different conditions. They're relatively similar, but they are still different from each other. So a heart attack, the symptoms can be chest pain or discomfort in the chest area, upper back or neck pain, indigestion, heartburn, nausea or even vomiting, extreme fatigue, dizziness, and then shortness of breath. For arrhythmia or an abnormal heartbeat, you might feel like some fluttering feelings in your chest. And then for heart failure, you might experience shortness of breath, fatigue, or swelling, particularly in your feet, ankles, legs, abdomen, or the veins in your neck. So who exactly is at risk for heart disease? So the CDC estimates that about half of Americans are at risk for heart disease. And there's three key indicators that can put you more at risk for heart disease. And that's high blood pressure, high blood cholesterol, and tobacco smoking. So it's estimated that about half of Americans have at least one of these issues, and that contributes to their risk of heart disease. Heart disease is actually a leading death among Native Americans. According to the American Heart Association, rates of heart disease are about 50 times, or not 50 times, 50% higher than white Americans, and more than a third of the deaths that occur from heart disease actually occur before age 65. So that's why it's very important to be able to know your risk factors and know how you can prevent them, so that way you can live a longer life for you, but not just for you, but for your family as well. So what exactly are the risk factors for heart disease? This isn't an all-inclusive list, and we'll go over a few more things that can impact heart disease as well. But really what I want to showcase here is that there are things that we can't control or manage and things that we can control or manage. And the reason I put kind of manage in parentheses is because if we look right here at stress, of course, we can't control stressors in our lives, but we can control how we manage them. And so that's where the management comes into play. But so things that we can control are things like our age, our genetics, and our family history, right? Because we can't control how old we get, we can't control our family history, and we can't control our genetic makeup, right? However, there are a lot of things that we can control. So for example, being at a healthy weight, and of course that plays into nutrition, our diets, as well as getting enough exercise, whether we smoke tobacco or not, whether we drink too much alcohol, and then of course stress. And again, I don't want to say that we can control stress, but we can manage how we interact with stress. And there's specific conditions related to or not related to heart disease, but these health conditions can actually increase your risk for heart disease. So for example, high blood pressure. So high blood pressure is when the pressure in your veins is higher than it should be, and this can put extra strain on your organs and in your body, which of course means it can impact your heart as well. High blood cholesterol levels. So if we have too much bad cholesterol in our blood, that can impact our veins and our arteries. So that can actually decrease the blood flow that goes through our veins and our arteries. And so that decreased blood flow can again kind of contribute to heart disease. And then type 2 diabetes. So diabetes can also impact heart disease as well. With diabetes, that means we have extra sugar in our blood, and having that extra sugar can actually damage our blood vessels. And then obesity can also impact heart disease as well. It's correlated that obesity has a correlation with higher levels of triglycerides and cholesterol. And so that's where that relationship between obesity and heart disease kind of comes from, is that correlation between cholesterol and triglycerides, elevated cholesterol and triglyceride levels, excuse me. So what exactly can I do to lower my risk? So the first thing you can do is eat a heart healthy diet. And so whether you follow a more DASH diet or incorporating more traditional foods like wild rice, berries, different wild game, different things like that, that's actually very good for our heart health, especially eating a diet that's low in salt, higher in potassium, and high in good fats. So fats that are liquid at room temperature, such as olive oils and different things like that. We want to stay away from saturated fats, which are solid at room temperature. So things like butter, animal fats, and even coconut oil can be, we do want to kind of limit. Making sure that we exercise regularly. So making sure that we get enough exercise. The CDC kind of recommends that we get 150 minutes per week of moderate intensity exercise. And so just making sure that we get 150 minutes of exercise per week. And we don't have to do it all in one day or all, as quickly as possible. It's actually best to space it out just to make sure that we're not hurting ourselves or anything like that. And then, of course, taking our medications if we're prescribed them. So these medications at this time, are going to help. So, for example, you might be prescribed high blood pressure medications or high cholesterol medications. And so just making sure that we take those as directed by our doctor. And then, of course, limiting alcohol intake. So I'm not saying you have to completely quit drinking alcohol, but just making sure that we limit our alcohol intake. And so making sure that we don't break that threshold of 1 or 2 drinks per day. And then stopping or reducing tobacco smoking. So tobacco can impact our blood pressure, which is, of course, bad for our heart. And so making sure that we stop or reduce our tobacco smoking. So if we're not quite ready to stop smoking tobacco just yet, even reducing can bring a lot of good to our body. And so that is all that I have for you today. As always, let us know if you have any questions. You can email us at healthpromotion@blick.net, or of course, just leave a comment below. And so I thank you for joining me, and I will see you again next month.